So when I give a person with type 1 diabetes testosterone, we have to lower their insulin. We just do. Why? Testosterone enhances glucose uptake. It enhances the action of insulin. What else does it do? It lowers triglycerides. Not every single time. It's not perfect. If you just think I'm taking testosterone, eat what I want, and my triglycerides get better, that will not happen. But it will have an impact on someone who's leading a healthy lifestyle. The triglycerides seems to be a little bit out of range. It will bring it in. Not every time, but it's enough to keep aware of that. And that's published in many journals. What else? I know that testosterone helps lower LDL cholesterol. Again, not perfect, but just be aware of that possibility. These are definite benefits to be aware of. Um, Another weird one, I'm just gonna say it out loud. When I get testosterone right and thyroid right, I see a really good impact on a patient's growth hormone release. If I measure it through IGF-1, I definitely see an improvement. It's pretty consistent. And growth hormone, I don't want someone to become taller or different. It's just my goal is, growth hormone at normal adult levels, it attenuates the degenerative effects of aging. So having adequate levels of testosterone impacting growth hormone can be a good thing too. So we always monitor those things. These are beneficial things from testosterone. In the literature and in practice, as I mentioned earlier, bone density is a big deal with women. Big, big deal. It gets overlooked. And I don't generally like to prescribe, bone building medications rather than use the hormones that help to build bone naturally and normally. Now, if you have a woman who has, estrogen receptor positive cancer, or a woman who does not want to use any estrogen, testosterone will build bone density. It just will. I have good success with that. And you use DEXA scans before and after to verify. As with everything I just said, I want to be sure you know this. It won't work every single time for every single person. That's how medicine is. It's important that we do our lab work to verify we got something and it did the right thing. And then it's important for us to run lab work to verify that it's not causing side effects or downstream metabolites that will lead to side effects. And that's going to be the next episode we're going to get into is how do we monitor this? How do we deliver this? How do we make the decisions to take it? Like what are the labs I look for? And how do I do this in a safe, healthy way?